What if the reason you're not healing isn't bad luck, but outdated strategy? And what if there are ways proven and emerging to support your body's recovery at a deeper level? Hi, my name is Dr. William Pierce. I'm a chiropractor. I'm board certified as a non-surgical orthopedist. I'm a sports injury specialist and also the co-founder of purplepeptides.net. For over 40 years, I've worked with more than 30,000 patients and logged more than 300,000 individual patient one-on-one visits, many dealing with injury, degeneration, and slow recovery. But today, I've got a personal story. I've dealt with injuries most of my life. I was a successful athlete playing football at a very high level. I experienced multiple fractures, sprains, strains, a severe knee injury requiring surgery, even a compound fracture of my lower leg. But last year, at 72 years of age, I faced something far more serious: open heart surgery. I had to have a genetic valve disorder and an aortic aneurysm repaired. And at that stage of life, recovery becomes a very real test, not just of your body, but of your understanding of how healing actually works, the realities of aging, and even facing the possibility of not surviving. After 50, healing changes. Cellular signaling becomes less efficient. Blood flow to injured tissue declines. Inflammation can become prolonged instead of controlled, and collagen production decreases. So when you get injured or you go through surgery, your body is working with a different set of rules. Here's where most people go wrong. They look for a shortcut, but healing still depends upon fundamentals. There are no shortcuts. It depends upon how you eat, how you move, how you sleep, and your structural and neurological integrity. You've heard that from me many times in the past. If those aren't in place, nothing else performs at a high level, and your healing process slows significantly. But once that foundation is established, we can talk about the next layer of healing. In my opinion, that's something called peptides. Peptides are signaling molecules that help direct cellular activity, including repair. Let me briefly walk you through 4 that I used in my own recovery. The first one was BPC-157. This is a peptide derived from gastric peptides, gastric juices. Research suggests it accelerates tendon and ligament healing. It also enhances something called angiogenesis, which is new blood vessel formation, and also supports gut and tissue repair. The second one is TB500, thymosin beta-4, a synthetic version of the naturally occurring peptide, and it's studied for its role in cellular migration to injury sites, tissue regeneration, and modulating inflammation. The third one is GHKCU, a copper peptide. This one really has been studied a lot, especially in wound healing. Research has shown that it stimulates collagen and synthesis of various soft tissue skin tissues. It also enhances wound repair and reduces oxidative damage. The third one is MOTS-c, a mitochondrial-derived peptide. That is where things kind of get interesting, because it's been studied for its role in improving metabolic flexibility, enhancing mitochondrial function, and supporting cellular energy during stress and recovery, especially from surgery. In simple terms, it may help your cells produce and use energy more efficiently during healing. In my own recovery, I use these peptides alongside a disciplined foundation: nutrition, movement, rest, and structured rehabilitation. And the results, according to my cardiac specialist and surgeon, my recovery was one of the fastest they had observed. I was in the hospital for only 4 days. I was fully released by my surgeon 1 week after I saw him. He said he didn't need to see me again. Now, I want to be really clear about this. I'm not saying that peptides alone did this, but I am saying they were a part of the strategy, and I believe they contributed significantly. Remember, peptides are not magic. They're not a replacement for proper care, but the research is still evolving. We're learning more and more about these things every day and the miraculous things they can do. Doesn't mean they're irrelevant. It means that they should be used intelligently and responsibly. So if you're over 50 and you're dealing with injury, surgery, or slow recovery, understand this. Your body hasn't lost its ability to heal, but it does require a different approach. The right foundation, the right environment, and the right signals. The question is this: are you still treating your body like it's 30? Or are you finally working on it at a level that your needs require now? Now, as you know, a medical disclaimer. This is for informational purposes, this video. It does not constitute medical advice. I'm a doctor, but I'm not your doctor, and no doctor-patient relationship exists between us. So please always consult your own professionals before making any decisions regarding your own health care. If you're interested in learning more about this, stay tuned, because in my next video, we're going to break down even more my step-by-step approach towards rebuilding health post-surgically. Thank you for your time, and I'll see you then.